sent his son. They called him Jesus. He came to love, heal, and forgive.
Hello and welcome back. Today we are going to study about the therapeutic ultrasound. So I welcome you so that we can journey together even as we get to understand what is this therapeutic ultrasound and how is it used in physiotherapy. So this is just a diagrammatic presentation or some images which are showing what therapeutic ultrasound is. So you can just take some seconds, you observe it even as we continue. Now we need to understand what therapeutic ultrasound is, and when I say that, that will take us to the definition of therapeutic ultrasound. So therapeutic ultrasound is just a modality that uses high frequency sound waves to generate heat and mechanical energy within tissues. And this energy which is produced can promote healing, reduce pain, and improve tissue mobility. So that is basically what an therapeutic ultrasound is. We need to talk about the types of therapeutic ultrasound. So ultrasound is majorly categorized into two groups or categories, which is based on the mode of emission. And maybe to mention, we have the continuous ultrasound and the pulsed ultrasound. So we will start with the continuous ultrasound, and even from the name continuous, which means there is a production which is in a continuous form. So generally, continuous ultrasound involves the continuous emission of sound waves. So it is continuous. And we have some few characteristics about this continuous therapeutic ultrasound. And the very first characteristic is that it produces a consistent heating effect in the tissue. Remember, it is a continuous one, so it will be consistent. There is no stopping. And number two characteristic, it is used for deep heating and to increase blood flow. Of course, when we talk about increasing blood flow, then you need to turn your mind to vasodilation. Of course, when vessels dilate, then there will be increased blood flow. Maybe it might be due to release of vasodilators, or else when that heat increases, you remember, increase in temperature, physiological effects. That is something told in physiology. So when there is increase in temperatures, the body will need to adjust the internal temperature. So vasodilation. Number three characteristic is that this continuous ultrasound, it is often used at lower frequencies. And when we say lower frequencies, we are meaning the range between 0.75 to 3 megahertz. So that is the low frequency. That's all about the continuous ultrasound. So I want us to flip the coin. We see how about this pulsed ultrasound. So pulsed ultrasound will involve the intermittent emission of sound waves followed by periods of no emission. So in simple terms, you find that in pulsed ultrasound, there is a period of continuous emission, then it stops. There will be no emission of the sound waves. That is what we mean by pulsed ultrasound. So what are these characteristics of the pulsed ultrasound? Of course, it produces both heat and non-heat effects, or else both thermal and non-thermal effects. we will get to understand that even as we look at the physiological effects, so don't be worried. Number 2 characteristic is that it can be used for both deep and superficial treatments. Remember, the continuous was used for deep. This one is used for both deep and superficial treatments, and of course it is applied at higher frequencies. That is the range between 3 megaambia. That is the range between 3 megahertz to 10. So that is the range of, remember, it is higher frequencies, so it is 3 to 10 megahertz. And this pulsed ultrasound is further categorized based on the duty cycle, and we have the high duty cycle and the low duty cycle. And the high duty is majorly used for heating effects, and the low duty is actually used for non-heating effects, that is such as stimulating of tissue repair and reducing of inflammation. And when we talk about stimulation of tissue repair, then we need to know that there must be increased blood flow to that point, and as well as increased cellular activities of the cells around that tissue which is to be repaired. So that is generally how the tissue repair is stimulated. I think that's all about the types of ultrasound, that is the therapeutic ultrasound. So I want us to flip the coin even as we check at the next thing. So here we have the frequency, or else the frequencies used for ultrasound. So what are the frequencies? You find therapeutic ultrasound, these frequencies will actually range between 1 megahertz to 3 megahertz, and we need to know what is the work of this 1 megahertz frequency, or else when is it being used, and what about this 3 megahertz? So the 1 megahertz frequency, it penetrates deeper tissues, so it has a higher penetrating power, and it can penetrate actually up to 5 centimeters of tissue, and it has a low energy absorption. Therefore, it can be used in treatment of rotator cuff muscle. I really understand that you know this even from your anatomy, so I don't need to explain much about the rotator cuff muscle. You are intellectuals. And the 3 megahertz, this one penetrates shallower tissues. That is just around 2.5 centimeters. And of course, it have higher energy absorption. That's why actually it is used for superficial treatment. And it generates more heat even as compared to the 1 megahertz. And so it is effective for muscles which are located superficially. That is the deltoid muscle and even the gastrocnemius. Gastrocnemius is part of calf muscles of the leg. They are just found in your posterior part. And the deltoid is the muscle located at your shoulder, at that joint of humerus. So that is basically the frequencies of ultrasound. So you can examine it well even as we continue. So what are the intensity for ultrasound? And we need first of all to have a knowledge of what intensity is, so that even we can dive in to understand it. And intensity just represents the power of ultrasound beam. Intensity is just basically the power of ultrasound beam, and it is measured in watts per square centimeter. You can see from the projection that I'm making here. So The intensity levels in ultrasound will vary depending on the therapeutic effects required. For instance, maybe you might be wanting to treat a deep muscle, so you will need to adjust the intensity. You will not use the same intensity for a deep muscle and a superficial muscle. You will need to adjust the intensities. So there are lower intensities or the low intensities that will range from 0.5 to 1 watts per centimeter square. And what is it used for? We find that it is just used for non-thermal effects. And when we talk of non-thermal effects, then you need to think of cavitation and actually acoustic microstreaming. Yeah, those are some of the non-thermal effects. I told you, don't worry, we'll get to understand them when we check out the physiological effects. And the low intensity, it is actually mostly or else commonly used in association with the low frequency. And the low frequency is the 1 megahertz. So the low intensity will go with the low frequency. So what about the higher intensities? That will range from 1 to 3 watts per square centimeter. And this one actually will generate heat, so it will produce some thermal effects. And it is commonly used in association with the high frequency, that is 3 megahertz. So let us check on the production of ultrasound. And when you talk of the production of ultrasound, then you need to be aware that ultrasound is produced by a machine which is called the ultrasound transducer. I hope you've seen the pictures which I projected first. Yeah, so it is produced by an ultrasound transducer, and this transducer contains a piezoelectric crystal. And what is a piezoelectric crystal? This is just a crystal which is capable to convert electrical energy into mechanical vibrations when an alternating current is applied. So an example of a piezoelectric crystal will involve the quartz, and there is a titanate. Yeah, those are some of the examples of piezoelectric crystals. So basically, when you are told to describe the production of ultrasound, then you need to mention about the ultrasound transducer. Then you expound more on the piezoelectric effect and even the reverse piezoelectric effect. You need to majorly dwell on those things. And as I have explained, so maybe let me mention a little bit on piezoelectric effect. And piezoelectric effect is just a phenomenon in which there is a production of small electromotive force from a piezoelectric crystal when subjected to external pressure. Perhaps it might be when it is subjected to the alternating current. So basically, that is what we refer by saying piezoelectric effect. So I want us to transition, because we have actually introduced the production, the intensities, the frequencies, types. So we need to know to which conditions is ultrasound used. So I want us to understand that. So let us flip the coin to indications. And for indications, there are several actually. And first is the anterior and posterior cruciate ligament tear. Anterior and posterior cruciate ligament tear. And I understand from your anatomy, you are well capacitated to know Yeah, you should be able to know the location of the anterior and posterior cruciate ligaments. Just to mention, they are just located around the knee. So it's your part now. You go, you study. By the way, during assessments, especially for electrotherapy assessments, then you will be assessed on your anatomy knowledge actually. So it might be quite unfortunate for you if you will not be able to know the location of the anterior cruciate ligament, that is the ACL, and even the PCL. Yeah, so be keen on that. So again, therapeutic ultrasound is used in the Achilles tendon rupture. And Achilles tendon rupture, or else the Achilles tendon, is just the tendon which connects the gastrocnemius muscle even to the calcaneus bone. So you need to get to know this. When it ruptures, actually therapeutic ultrasound is the most appropriate in management of that condition. Again, there is the medial meniscus tear. We get to understand even there is pain. And when we talk of pain, then you need to be in a capacity to explain the mechanisms through which ultrasound will use to reduce pain. Maybe it might even reduce the joint stiffness, or else relax tense muscles. It will reduce pain and even increasing blood flow. Yeah, those are some of the ways. Let us continue even with the indication. Actually, this is more explained. ACL, PCL is generally the anterior and posterior cruciate ligament. Let us start from number 5. And in number 5, we have the lateral epicondylitis, which is referred to tennis elbow. And tennis elbow is just the swelling of tendons that bend your wrist backwards away from your arm. So when there is an inflammation in those tendons, actually most of the times it will occur around your elbow joint. That's why it is called the tennis elbow. So when those tendons will get inflammation, then there will be that condition which we refer to as the lateral epicondylitis. There is the bursitis, and bursitis is just the inflammation of the bursa, or else this is just the sheath which covers a bone. So when it gets inflammation, then that is what we call bursitis. And actually therapeutic ultrasound is much convenient in dealing with that condition. Yeah, because actually, of course, from your pathophysiology, you know that inflammation will be accompanied by pain most of the times. So ultrasound will be better for that. And we have tenosynovitis, which is just the inflammation of the sheath covering a tendon or else a ligament. Yeah, a ligament. That is what we call tenosynovitis. So I want to project some pictures of this is tennis elbow. I think you can just take some few seconds to observe. You can see its location actually, and you can see the tendons. Yeah, those are sorry. Yeah, this is again the bursitis, and you can see there is the inflammation. You can see the inflammation. Yeah, let me just write it for you. You can see this one here. Yeah, those inflammations. And this one on the other side, this is bursitis. Get to know that. And this is the tennis elbow, the other picture here. You can see this inflammation here. This is the elbow of a human being. So you can see that inflammation there. So I think we can continue now. At least we are at somewhere about the indications. So I want us to take a glimpse on the contraindications or which conditions you should not use a therapeutic ultrasound. So the first contraindication is the cancer. And when we say about the contraindications, then you need to explain why is it not used. For instance, in cancer, you should not use therapeutic ultrasound because first of all, it will increase cellular activity. So those unwanted cells, the cancerous cells, will actually be actively dividing, and as well it will increase metastasis of these cancerous cells. So that's why it is contraindicated for cancer. In children, when therapeutic ultrasound is contraindicated to children because it will affect the epiphyseal plate. Those are the growth points of bone, and if it will affect them, then there might be a problem in the bones, even making a child to be highly susceptible to fractures. And during pregnancy, it is again a contraindication because it will increase mitotic division of the fetal cells, which might result to some unwanted condition or malformations, which we call them in embryology anomalies. And ultrasound should not be used near or over eyes. This is because it will damage the retina and even the eye lens. Again, it should not be used around the eyes, around the heart, that is around the heart. And the reason as to why ultrasound should not be used around the heart, it is because it will interfere with the electrical signaling of the heart, and this will lead to some conditions such as the arrhythmias. Yeah. And again, therapeutic ultrasound should not be used over reproductive organs. This is because they are so sensitive and it can even damage them. So I want to imagine in a case maybe you are controlling a certain condition or else in a rehabilitation, and then your gonads are damaged. You do not have ability to do something good. So it should be contraindicated for that. I want us now to look at the physiological effects. And physiological effects are grouped into two. That is the thermal and non-thermal. And if you have a good memory, there is somewhere we mentioned the non-thermal. So if you can remember, keep it in mind. We are going to handle it in a little while. So the first thermal effect is increased blood flow, and of course this is because of the vasodilation due to the heat production. This will increase blood flow. Of course, therapeutic ultrasound will reduce muscle spasms, and again reduction of joint stiffness. And how does joint stiffness be reduced? This will occur, it will actually lead to relaxation of tense muscles, and if these tense muscles are relaxed, then the joint stiffness will be reduced. And of course, joint stiffness leads to a reduced range of motion, and therefore it will consequently even increase the range of motion. Number 4 is that there will be increased metabolism. Yeah, of course there is some production of it, so the body metabolism will increase. And in modulation of pain, I think I had handled about pain some time back, so just go and check on that. Now, the non-thermal effects of the therapeutic ultrasound. First of all, we have the cavitation. And what is cavitation? Cavitation is just the formation of microbubbles on tissues or else on the surface of a tissue when you are using therapeutic ultrasound. That's why when you are using therapeutic ultrasound, remember you will be required to apply a coupling media. So once you put it into contact with the surface or else the body of a person, you are not allowed to remove it because this will cause cavitation, which is the formation of the microbumbles. And again, there's the microstreaming, acoustic microstreaming. You will go and look on that acoustic microstreaming. Maybe to mention on how do we use therapeutic ultrasound is that your patient needs to be in a comfortable place, yeah, a very safe, quiet and well lit. Again, if it will require undressing, then they should undress the only part to be treated. And so you need to apply a coupling media. You first apply a coupling media, then ensure that your device is on. Then before you do your settings, you ensure that the transducer is in contact with the skin, so that you do your setting even as to start your therapy. And you do not let the transducer to be just on one point. It should be moving to avoid burning your patient. And you should just be moving it in a figure 8 form, yeah, like you are drawing figure 8 or else a 0. Yeah, that is the way you should move your therapeutic ultrasound during treatment. So what are the therapeutic effects? And therapeutic effects of ultrasound will include there will be improved circulation, that we have already mentioned about it. You are well capacitated with that. There will be healing process will be actually stimulated, or else it will occur more effectively. And this is through there will be increased blood supply to the point of injury. And equally there will be stimulation of the cellular activity around that point, so the rate of healing will be increased. Again, it will reduce pain and equally reduce inflammation. And on the part of reduction of inflammation, this is it will increase actually the lymphatic flow. And this lymphatic flow will help to move maybe those accumulated fluids from a joint even away from it. Yeah, that is generally about the reduction of inflammation. So I want us to check our last part, which is on the dangers of ultrasound, and then we will have been done with the lecture about ultrasound. Now, dangers, of course, if you keep the transducer on one point, you will burn your patient. So dangers: 1, burning or else burns. Number 2, hemorrhage. Hemorrhage, this is just excessive bleeding. Perhaps you might find a patient with an injury or else a wound which is bleeding. When you apply therapeutic ultrasound, remember it will increase blood flow. So this will lead to fatal consequences and thus hemorrhage. There is the blood cell stasis and endothelial damage. Yeah, so generally those are the dangers of therapeutic ultrasound. And with that, I think we are done with our lecture. So maybe you can even take a glimpse on this even as we come to an end. Thank you.